All right, I would ask you to stay for our guests. Are you? I just want to make sure Stephen is connected or guest connected, and if they could be put up on the screen, please. Great. I will see you. I think who will Stephen? Will you go? Will you go first?
Yes, I will.
Great. Okay, so Stephen, please go ahead. Thank you.
All right, thanks, Steph, and good afternoon to everyone. I will kick things off and give a general update on what is happening with respect to the earthquake, and then my colleague, who's the area manager in the eastern region of Afghanistan, Anatoly, who's also online, will give some of his first-hand experience of what is happening on the ground. Now, as everyone already knows, on August 31st at close to midnight, there was that 6.0 magnitude earthquake which struck the eastern provinces in Afghanistan, leaving a wake of destruction in mostly mountain communities across three provinces, Nangarhar, Kunar, and Laman. Since then, including this morning, there have been strong aftershocks which continue to rattle the region, further terrifying families, but also worsening road conditions and hindering rescue and relief operations. Unfortunately, and this I heard from my UNICEF and UNFPA colleagues, some of the relief workers got injured from yesterday's quake as well. The human toll is high, and I think, Steph, you reported on this. According to the latest assessments, more than 2,200 people have lost their lives, and nearly 3,700 have been injured. At least 6,700 homes have been destroyed, and we have seen entire villages built on steep hillsides have collapsed. And you'll hear a bit more about that from Anatoly, who has actually visited some of those communities. But beyond the loss of life, we have also seen basic infrastructure and livelihoods destroyed. As you know, OCHA has deployed 25 teams to do rapid assessments in the provinces and their districts. And their data is showing approximately 84,000 people affected by the earthquake. Schools, health facilities have collapsed. 68 major water sources have been destroyed, cutting off access to safe water for thousands of people. And FAO indicates that perhaps close to 1 million livestock have also been affected in some of those provinces, primarily Nangarhar and Kunar. And as usual, it's the poorest households that are living in fragile mud and stone dwellings that have suffered the most. Of course, the humanitarian partners are on the ground. Access remains difficult. And again, you will hear a bit more on that, those issues of access from Anatoly, who attempted to access some of those regions recently. Nonetheless, the emergency response is scaling up. Thousands of tents and non-food items are now arriving for distribution. Mobile health teams are treating the injured. More than 20,000 people have already received food assistance, and water trucking and sanitation facilities are being set up to prevent the outbreak of disease. You've also heard that the UN has mobilized an initial 10 million from pooled funds, and donors, including the UK, the Republic of Korea, and Australia, have contributed. Other regional neighbors, including India, Pakistan, Iran, Turkey, and others, have provided in-kind support. But far more is needed. And you also know the immediate priorities: shelter, food, safe water, sanitation, emergency healthcare, and of course, psychosocial support. Children, women, and people with disabilities remain most at risk. And with winter approaching, because this is the very mountainous region which gets very cold, time is short for us to provide relief. Now, this tragedy, and this is one of the main points I want to convey, comes on top of multiple overlapping crises that Afghanistan has been experiencing. For example, communities in the East had already endured flash floods in August and major droughts earlier this year. Currently, 19 of the country's 34 provinces are facing the worst drought experienced in decades. And you know about the millions of Afghans who are being forcefully returned from Pakistan and Iran. In UNDP, our latest socioeconomic assessment of the country shows that 75% of the population, that's 3 out of every 4 Afghans, are struggling to survive at a subsistence level, meaning they can barely afford to meet their basic needs. As my senior economist here in Afghanistan put it when he was speaking to the New York Times recently, Afghanistan is facing a perfect economic storm. So the region that has been struck by the earthquake is also one of the main areas where returnees are resettling, and they're often in extremely poor housing conditions and with limited livelihood opportunities. Host communities, already under significant pressure, are now facing even greater challenges. And this is why our response must go beyond immediate relief. Humanitarian aid is crucial to save lives today, but recovery and building for resilience must also start now. We need to help those communities clear debris, rebuild homes with safer techniques, restore schools and clinics, but also revive local markets, local businesses, local agricultural activities, and create jobs. UNDP and our partners will be working with the affected communities on what we refer to as community-driven recovery. That means we'll be providing cash for work so families can earn an income while clearing rubble and rebuilding homes and infrastructure. We'll be supporting the safe reconstruction of homes and transitional shelters. We'll also be repairing water systems, roads, and other community facilities. We'll help small businesses and farmers to recover, because we know that without livelihoods, there's absolutely no chance for resilience. We'll, as UNDP, will also focus on providing renewable energy for households and for public facilities such as health centers and schools. And in all our programs, we'll ensure that women, but also the returnees and vulnerable groups are fully included in the rebuilding effort. We've seen that in the past earthquakes, such as in Herat in 2023, this community-driven approach works. And with the right support, Afghan communities will show extraordinary resilience and solidarity. Anatoly told me of what he saw in one village with some of the young men walking over 13 hours over mountain passes to help neighbors in other districts and communities. So I want to leave you with 2 messages, dear colleagues. First is that the needs are urgent. Tens of thousands of families are living outside in makeshift shelters, and they're fearful of aftershocks. And with winter approaching fast, we need to act equally fast. The second key message is that we must seize this crisis as an opportunity to build back better, to reduce vulnerabilities, to restore hope, and strengthen stability. And this requires not just the short-term humanitarian assistance, but longer-term investments in resilience. But before I conclude, and I saw this in your your press statement yesterday, Steph, and some of the questions that were raised, I want to address one of the questions that have come up in my interviews as well with the media, which relates to the restrictions on women and girls in Afghanistan. Yes, those restrictions exist. And yes, they have an impact on our work. They limit our ability to recruit female staff, which is essential to reach women and girls that are in need. And this also undermines the country's longer-term recovery, because the country is excluding half of the population from education, from employment, from public life. So this will set back Afghanistan's development. And it's also a challenge to our humanitarian relief efforts. That said, I want to address directly the reports that in the context of the recent earthquake, women are being prevented from receiving emergency medical care. We have looked into this very carefully. What we're finding is that these appear to be isolated incidents, excesses committed by a few local actors, rather than a systematic restriction. For example, a trustworthy source at the Nangarhar Hospital confirmed that around 20 women were evacuated by helicopter from Kunar province and admitted for treatment. Similarly, I spoke with my WHO colleague earlier today, and he indicated that in the affected area, all critically injured patients, including women, were being transferred for health treatment without restriction, depending solely on the severity of their injuries. So while the restrictions on women remain a broad structural issue, in this specific earthquake response, we have not seen evidence of a systematic ban on women either participating in the relief efforts or receiving urgent medical care. The UN is, of course, monitoring closely, and we will continue to advocate strongly to ensure that women and girls have safe, equal, and unimpeded access to all humanitarian and medical services. So to conclude, the UN stands in solidarity with the Afghan people in this moment of grief, but international support is critical, and we will be launching an emergency appeal in the coming days. I think OCHA has indicated on the 8th of September, and we urge member states and partners to step forward quickly and generously. Now, let me ask Anatoly just to give 2 or 3 minutes of his first-hand experience from the region. Thank you.
Thank you. Thank you very much, Stephen. Anatoly, please go ahead.
Thank you, Stephen. Good afternoon, everyone. Greetings from Jalalabad. My name is Anatoly. I'm area manager of UNDP based here in the country. UNDP has very strong presence in the region. Our office is covering 4 provinces, Nuristan, Nangarhar, Lagman, and Kunar. And 3 of those provinces has been heavily hit by the recent earthquake. We have an excellent team here, and we already conducted several site visits, and I would like to share my first-hand experience about one of them. It was Sutan village in Darinur district of Nangarhar province. This place was already on our radar due to recent flash floods, and also that they have received many returnees. So we know the area very well. The village located in a very remote area, mountainous. It was very hard to reach. We have seen many evidence of the recent landslides, which were fortunately already removed by the locals. So we could access this area. Also, at the same time, I would like to highlight that this place is very typical victim of this earthquake. Other places are very similar to that. So Sutan village is the place with around 7,500 people living there. I met with locals. I was looking at the damage, and that was heartbreaking. In this particular small village, there was 12 casualties. Out of them, 8 were children, small children, and two victims were recent returnees from Pakistan. So those people has been suffered for many years. They went a long way, and now they received another disaster. And besides, we had around 60 people injured in this place, mainly because the buildings are constructed from mud, stone, and wood, as Stephen already mentioned, and those are easy to collapse. The more wealthier people use modern technologies, use concrete, and those buildings are still exist. They are not collapsing, and that's revealed the truth about earthquake. It hits mainly the most vulnerable people. I saw parents who are deeply grieving now. Many of them lost multiple children, unfortunately. Now, entire community is just living outside. They are afraid to come back. More than 300 shelters has been destroyed or damaged, and it's natural that people are afraid to coming back, and because they are afraid that earthquake will repeat again. And actually that happened yesterday when we had another very strong earthquake or aftershock, whatever you call it, and that caused additional damages, multiplying already delivered destruction. Now the number of, I received the call from this village, and I can say that the number of injured people raised to 82, and more than 400 houses are now destroyed. What else? The second source of people dying was not only because of collapsing walls and roofs, but also from rock side. Earthquake caused some shakes, which led to the landslides, and in one place, 13 years old boy was killed by a falling stone while he was still in bed, and his 2 siblings also has been severely injured. Now rescue operations are still ongoing. There is still many areas which are very hard to reach. People are going there by foot or by helicopter. But even in this very difficult time, Afghan communities are showing very strong resilience. They are very well organized on the local level, and that will make us possible to deliver area-based interventions directly to those communities and directly to those people who are suffering. And we're looking forward to start our early recovery operations and to help those people as soon as possible. Thank you.
Thank you very much, Anatoly. We'll now take some questions. Deji?
Hi, this is Deji Shu with China Central Television. We know this is not the first time we have an earthquake in Afghanistan that caused massive death tolls in the country. I'm just wondering, is there a way to build resilience for the next time? Because it seems this is never going to end. Thank you.
Please, go ahead, either Stephen or Anatoly.
Let me start, because it's an excellent question. And this is why I mentioned that the building resilience is not a short-term project. What Anatoly said earlier, that the poorest are usually the most affected, whether it's by earthquakes or floods or any of these major disasters. The poorest are the ones who build houses close to riverbanks. And so when there are floods and flash floods, they're the ones who suffer. The poorest are the ones in Herat and here in these villages who have mud houses. The poorest are the ones who don't have assets. And so when there's an economic shock, when they lose their jobs, they have nothing to fall back on. Addressing that requires us to deal with those structural issues of poverty and unemployment in Afghanistan. And this is a context because Afghanistan is one of the very poorest countries in the world. Its GDP per capita is close to the very bottom of the list. The economy today is smaller than it was in 2011. When the Taliban took over and the government collapsed, the economy also collapsed by a staggering 27%. So poverty and unemployment are extremely high. And so the kinds of investments that are needed are investments in job creation, in revitalizing the economy, in providing communities and people with proper healthcare, with proper education, but also investments in basic social services, in people having access to water and energy. This is what works in every other society, including the developed societies of Western Europe or the US. It is the poorest who are always the one who suffer again and again when a crisis hits. And that's what resilience requires, building in that manner.
Thank you. Yeah, Amélie, and then go.
Thank you. Amélie Botelier from AFP News Agency. You mentioned the emergency appeal that will be launched in a few days, but I guess it's for emergency relief effort and humanitarian aid. But a follow-up to Deji's questions, rebuilding is something else. So do you have any kind of estimates of how much money would be needed and how long would it take to rebuild everything that's been destroyed, but in a better way for it to be more resistant to any future disaster? Thank you.
Thanks for the question. It's a really great question. Two things. One, within the humanitarian country team here, we have said that we want any flash appeal that goes out to include both the immediate relief and humanitarian assistance component, as well as the recovery component as well. So we expect that flash appeal to include both components. But secondly, I wouldn't want to go ahead of OCHA because there's a coordinated effort being made. I mentioned there are 25 assessment teams on the ground currently that's looking at the needs based on the damages that have been that have occurred. The World Bank is also looking to do its own damage and loss assessment using its methodology. We're using satellite image from the area, and we'll pull all of that data together to address both the immediate humanitarian needs, but also the recovery needs for those communities. For UNDP, we estimate an initial 8 million for the kinds of work we would like to do, including rebuilding shelter, transitional and permanent houses for the communities, rebuilding some of the roads, providing energy, renewable energy for these households, etc. But that's just one small component of the broader picture. But we'll have a complete picture by the 8th of September is the projection from OCHA.
Thank you. Yes, please go ahead.
Jennifer Levine, Interpress Service. Given Afghanistan's political isolation and that many countries do not recognize the government, how is the UN working alongside the Taliban to effectively provide aid?
That's also an excellent question. And the simple answer to it is, when it comes to humanitarian natural disasters or man-made disasters, the humanitarian principles hold: humanity, impartiality, independence. And so we have made this case to the de facto authorities from the very beginning, whether it is dealing with the droughts or the Herat earthquakes or other disasters that have occurred, that these principles are fundamental. Now, the interesting thing is, I think they've learned some of these lessons from the past. We had some difficulties initially, for example, in Herat, getting access for some of our female staff to attend to females in some of these communities. But from what we've seen in this current disaster, they're working hand in hand with us, coordinating very closely. And by the way, these are very mountainous regions that are otherwise impassable. And so we can only get to some of these places using their helicopters and their assets, and they're making those available. But they're also allowing female aid workers to access the regions, usually, of course, with a mahram. And as I indicated earlier, they're also allowing females to be transported to hospitals and health facilities to receive treatment. So I can say it's been almost exemplary in this particular instance. And I guess there's been some growth in that relationship since over the last couple of years, and a full understanding that humanity comes first, tending to those most in need, irrespective of ethnicity, of gender, of anything else. We must provide assistance to those who are in need.
Thank you. We'll go online. Iftikhar? Iftikhar Ali?
Thank you, Steph. Thank you, Steph. Sir, this is Iftikhar Ali from Associated Press of Pakistan. With all the roads damaged in the impact area, how are you delivering aid to these survivors?
Anatoly, do you want to speak to that?
Yes, many roads still are locked. As I mentioned, they are very poor quality initially, even before the earthquake. They were unpaved, and there is no protection against landslides. Now, with the support of the de facto authorities who providing the heavy machineries, those landslides are being removed, and all humanitarian assistance now starting to reach those areas. I also know that they use helicopters to deliver some medicine, some essential medicine to the affected areas as well. And also they deployed military forces to go there by foot and to deliver needed support in this way. Thank you.
Thank you.
Thank you very much. Any other questions? Thank you all. Stephen, Anatoly, thank you so much for joining us. I know it's very late there and you guys have a lot to do, but we hope to welcome you back soon. Thank you all.
Thank you. Take care.
Thank you.
Bye-bye.